Hey guys, this week on Sam Scoops, we're looking at two stories that originate out of the Midwest, where I'm actually from, but can translate to problems across the entire country. The first is about healthcare. So when you go to the hospital, that's a lot of money. So you should think doctors and hospitals should be rich with how much money they take from us. But actually across the country, hospitals are millions of dollars in debt and closing. So we're looking at why that happens and what's the impact. And then the second story is about sexual assault on college campuses. Now, those two pairings are nothing new, but we're taking a look at what happens when those reports are made. What happens to those that are accused of sexual assault, and do they always get the punishment that they deserve? So we'll start with that first story on healthcare. So this is actually a documentary that came out of Nashville. I believe it was, let's take a look here. It was Channel 5 in Nashville, and it was called Emergency at the ER. And so this is a story where they looked at rural hospitals across Tennessee. And they kind of zeroed in on ones of why they were closing. I guess the big problem is 21 counties across Tennessee are without a hospital at all. And in the last, I believe, 5 years, 12 rural hospitals have closed, and that stat, to give you some perspective, is about the second highest in the country. And so they were zeroing in on these, and for some of these counties, especially in rural areas, that hospital was the biggest employer for the area. So with that closing, not only do patients have to go over to the next county and add time to that wait between, I need emergency care now and actually getting serviced, which can obviously be the difference between life and death. But also ambulances. Some counties don't have an unlimited supply of ambulances. So if I have to now take, grandma who just had a stroke all the way to the next county, and that's 1 hour one way, you're looking at least 2 hours, one ambulance is in commission. So again, if all the ambulances are out and someone else gets hurt, another difference between life or death. And those are some of maybe the obvious connections there, but the story also looked into a little deeper. If you're the largest employer and you go out of business, people might move away. So they saw home sales were getting affected by this, and school attendance rates. And it wasn't just at one hospital. They looked at all these different types of hospitals. And then in terms of that cost, one of the hospitals was negative $2 million in debt. So they really didn't have a choice, I guess. And how that happens is the way they explained it, or they hypothesized that Tennessee didn't expand Medicare a few years ago, and so more people were left without health care. But when you come into the ER, they don't just turn you away. And so a lot of the hospitals were racking up bills that just went unpaid for people who didn't have insurance. So it's a really interesting look at a subject that affects so many of us, but isn't always sexy in television, because healthcare, how do you visually show that? But they did a really good job with it. And by the end, it was kind of a solution based too. They were looking at one hospital that was, closed and dark, and how do we revitalize this? And I think it's going to take a lot, not just at local levels, but probably with governments to maybe restructure how we offer healthcare. But they kind of give some insights at the end of this documentary. So again, the link for that will be there. But if you've ever wanted more insight about healthcare, you can go into this story. So that second story about sexual assault comes from Illinois, where I'm actually from, and it's a partnership between the NPR station in Illinois and ProPublica, and they're looking at specifically the University of Illinois. And they found 7 cases that were never talked about before of students who report incidences against specifically professors that they're looking at. So that's like sexual harassment, sexual assault, those kind of claims. And the university was able to keep these under wraps until the story was able to come out. And so in one instance, there was 3 complaints about a single professor for sexual harassment. And so when these allegations come up, the professor faced discipline and termination, but instead none of those happened. The university actually took steps to keep that reputation in check and continued to pay that professor $1 million. And then when he departed to a new university, they kept that reason for his leaving under wraps. And this article kind of went in and found that confidentiality clauses were a common thing. So these professors were facing these accusations at one university, able to kind of, work together and sign a secret. So neither the university nor the professor could talk. And then they would go on to a different university, and maybe that university would screen that candidate before hiring them, but because it was all under a clause that they couldn't talk about, it, got brushed aside. And so that was, crazy that that can happen, and very interesting that they found, these cases where it was able to just continue. And it was not just this one professor. They outlined a few different incidences where the university helped keep professors having unblemished records. And one of the issues that it kind of discussed, which is interesting when you think about tenure with professors, it kind of is a level of protection that can help them, not get in trouble, not get terminated. But how do you apply that when there are these serious allegations against an individual? And so that was one of the discussions in there. I think the university has since stopped having confidentiality clauses. There's another incident, just to highlight, where a professor forced worker to stay overnight, but the university found that he violated a conduct code, but not a sexual misconduct code. And even though that same professor received multiple complaints similarly, I believe is what they reported. So it's like, how do you make this definition? I guess there's a loose definition of what sexual misconduct counts as. So that's one of the stories. I think is going to be a series of stories. So if you're interested in that, you can continue to follow it. Last interesting point on that note is at the end of that initial report, the NPR station kind of asked, if this has affected you, we want to hear from you and, send in tips and things like that. Well, I guess the University of Illinois responded to them and was saying, well, you need to turn over any information and disclose those sources to us. So that's a university policy that you have to, disclose when something happens. Because, at schools there are like mandatory reporters of if you hear something, you say something. But this NPR station, I guess, is completely separate. So they had this whole long article about how they were going to protect their sources and how this university policy did not apply to them. So it was another interesting discussion of how you continue to tell these narratives and highlight these issues on college campuses and how campuses are responding for change or for not change. So those are the two stories I have for you guys this week. I hope you find them as interesting as I did. That second one is an article. So reading, TV, I like to give you a little bit mix of both, depending on your preferences. But that's what I got for you. I hope you enjoy these investigations.